Hello and welcome back to Unacademy. So let's get NEET PG. Myself, Dr. Muskan Chaudhary, and in today's session, we'll discuss images. Starting with Unacademy. So in Under Plus subscriptions, we get access to both the live and the recorded sessions, learning from the India's topmost educator and competing in the live TNDs. So starting with a device of your choice and anytime and anywhere. So assessing up to only 5,000 of the MCQs. Under IACO subscription, Academy and Prepared has come together for clinical interior essentials with lecture QBanks, rapid revision, and the dream notes with the live batch, recorded sessions, and the printed and the digital notes. Under NEET PG Plus category, that is for two, it is costing us around 36,000 rupees. That is around 1,500 per month. And for 2 years, it is 58,500. That is 2,438 per month. Alright, please do use my code that is Muskan10 to get further 10% of the discount. Now, with highly effective Q banks with the high yield clinical questions based on latest examination patterns and the detailed explanations, special class features include the live classes. We can do the polling, respond to the polls for better understanding, and raise a hand feature. Never miss a class because we'll get the notification for the same and download the lecture notes, get the lecture notes and recorded sessions set to any time and any part of the world. So target NEET PG batches that with well-structured batches suitable for the learners and the GTs, clinical questions, PDF notes and the practice question with FMG batches for the structured batch, FMG GTs, recorded sessions, PDF notes and around 24,000 of the MCQs that are being available. So we'll start with the first image of the day. I will give you around 20 seconds for each image and we'll discuss it. Yeah, hi, very good evening. Yeah, very true. This is Clostridium tetani. Now, how did we identify? Now, fun thing is that we have two bacteria which are spores forming. Now, one is B and another C, that is the bacillus, and another is the Clostridium. All right. And in the Clostridium, we have either the terminal, subterminals, or the central spores. You can see these are the terminal spores, but in the terminal spores also we have two kind. One is the terminal, and that is circular in shape, just like this one, that is similar to that of the drumstick appearance. Another one we have terminal, but that is oval in shape, that is similar to that of the tennis racket appearance. Now, drumstick appearance we get in which that is the Clostridium tetani and the Clostridium tertium, that we get the oval and the terminal spores giving appearance to that of the tennis racket. So this is the Clostridium tetani with that of the terminal and circular or the spherical spore. All right. Yeah, very true. That is the terminal spore. Now, we talked about the terminal spore that is round or circular with the closed tritium tetani, and the tertium that is having what the oval and the tennis racket appearance. Apart from this, remember they are uncapsulated. Clostridium is uncapsulated, but we have the exception that is the Clostridium perfringens and the Clostridium vitaricum that is capsulated. Go to the next one. Identify. Yeah, that is the Robertson cooked media, cooked meat broth. All right, and this is used for these are the beef heart particles. These are the beef heart particles that is having what? Glutathione, and this glutathione keeps the oxygen reduced state, and that is for typically we use for the obligate to create an anaerobic condition, and that is for the obligate anaerobes. And if you know the examples of the obligate anaerobes can be remembered by the CAB or ABC. That is, A is standing for the actinomyces. Then we have B for the bacteroids and C for the Clostridium. So that is the obligate anaerobes, and typically we are using the Robertson cooked media broth for that of the Clostridium. Going with the next image. Identify this one, that is the B image. Yeah, that is the swarming motility. And where do we see that? This is a blood agar representing the swarming motility. And where do we get the swarming motility? Yeah, very true that we get the swarming motility in the proteus. But apart from the proteus, we also have the certain examples that also shows the swarming motility, and that is in the PVSC. What does the P stands for? P stands for the proteus, and V stands for the Vibrio, that is Vibrio parahemolyticus. Then we have S that stands for the Serratia, and C that is the Clostridium. Which one? That is the Clostridium tetani. So that is the swarming motility. Although we remember, always remember the example that is the Proteus, but apart from the Proteus, we have the Serratia, Clostridium, Vibrio parahemolyticus, and the yeah, we are done with the four examples. Now, parahemolyticus also have the safety pin appearance. We'll see the examples for the safety pin appearance, and the Vibrio parahemolyticus also has the safety pin appearance. And what do we do to inhibit the swarming motility? How do we inhibit the swarming motility? Yeah, we just don't add, we increase the concentration of the agar. Just adding agar, matlab, agar has different concentration, that is its itself its importance. Like if we add 0.5% agar, then it is to for the to make the semi-solid liquid. Because the basic function of the agar is the solidifying the media. So we 0.5% we may generally use to seek the hanging drop motility. All right, and for 1 to 2% we mainly use to make the medias, and that is talking about we generally use 2%. Then we increase the concentration to 6%. More we add the concentration of the agar, more the media will be solidified. So increase the concentration of agar to that of the 6%. Other than this, add the bile salts or use the McConkey agar or the clad media, or by the addition of what? By the addition of the ferrous ions. Alright, so this is how we can inhibit the swarming motility shown by the Proteus, Serratia, Clostridium parahemolyticus by the addition of the agar, or on the McConkey agar clad media, addition of the bile salts or the ferrous ions. So that is about the swarming motility. Now next test. Yeah, this is true. This is Nagl's reaction, which is shown by which bacteria shows the Nagl's test, Nagl's reaction. That is by the Clostridium. Now, which Clostridium shows the Nagl's reaction? That is the Clostridium perfringens. Why is that? So, Clostridium perfringens has two types of toxin. One is the major one, and another is the minor one. Now, major one are the alpha, beta, eta, and all. Amongst this, the alpha toxin, that is what the alpha toxin or lecithinase toxin, that is the most important for the virulence of the Clostridium perfringens. And what does the Clostridium perfringens causes? That is the gas gangrene. Alright, and gas gangrene is caused by which of the Clostridium? That is the perfringens, then novi, and then the septicum. That is by the P, then N, then S, that is PNS, that is responsible for the gas gangrene, and the most common is the perfringens, novi, and the septicum. Alright, apart from this, Clostridium perfringens has some other special properties. Already we saw that it is capsulated. Another important point that we discussed is the Naglos test. And we'll see how do we do that. That is a Naglos test. Apart from that, it shows the target hemolysis or the double zone of hemolysis. And what is? That is the reverse cam test. Reverse cam test. And what is that we saw? That is the gas gangrene. Alright, so some important points about the Clostridium perfringens is gas gangrene, target hemolysis, reverse cam test, gas gangrene, Nagl's reaction. Now, apart from the Clostridium perfringens, Nagl's test is also shown by some other organism. If you can name that. That is Bacillus. Bacillus anthracis, that is another bacteria that also shows the Nagl's reaction or the Nagl's test. That is the Nagl's positive due to lecithinase activity. Now these are the Clostridium inoculation, and here no toxin is there. Now here toxin is present, antitoxin is present against the alpha lecithinase toxin. So this will show a zone of the opacification that is present at the contact of the toxin and the antitoxin. Now, another one, Clostridium, we already saw that is alpha and beta, both zone of the hemolysis. That is the double zone of the hemolysis or the target hemolysis. Moving next, that is a reverse cam test. Now, originally cam test we used in the for the group B streptococcus for the streptococcus agalacti. All right. Now, reverse cam test here we don't identify the group B streptococcus. We use the group B streptococcus for the Clostridium perfringens, and that is the reverse cam test that have we named it. So it is different used for the differentiation of the perfringens from the other Clostridium species, and you can see the arrowhead over the contact between the Group B hemolytic streptococcus and the Clostridium perfringens because of the increased zone of the hemolysis. Here you can see that is the CAM positive group B streptococcus is streaked along with the Clostridium perfringens at the perpendicular angle, and the enhanced hemolysis at the point of the contact is seen between the growth of the group B streptococcus and the Clostridium perfringens. Alright, so moving next, identify this one. Yeah, this is the tetanus and the log jaw. This is the log jaw with the smiling face, that is we are talking about the Clostridium tetanus. Now, Clostridium tetani, it has two types of toxin. One is the titanolysin and titanospasmin. So, spasmin. So, titanolysin is not the pathogenic toxin and doesn't even has the role in the violence. It is the titanospasmin, and for the name itself, that it causes what? The spastic paralysis. Causes the spastic paralysis. How it causes the inhibition of the release of the inhibitory neurons, that is the glycine and the GABA. And the first symptom amongst that is a appear, that is a lockjaw. Apart from this, the complications that it presents with opisthotonous position, and what is that is the rhizus sardonicus. Alright, that is the Clostridium tetani. And in the unit, that is also known as the eighth day disease or the neonatal tetanus. What is the incubation period for the tetanus? That is around 10 days. Alright, so important to remember, it is a spastic paralysis, and the trypanospasm has a major role toxin, and the lockjaw, that is the image that we're talking about, is amongst the first symptoms to appear, and the rhizus sardonicus and the opisthotonous other complications with the name, that is the an incubation period of around 10 days. Now moving to the next image. Yeah, this is the pseudomembrane colitis. Pseudomembrane colitis, and it is not a true membrane that is involved, that is a pseudo membrane, and responsible for mainly it is infecting what the colon, causing the inflammation of the colon and the pseudo membrane over the colon mucosal areas. It is generally after the most important risk factors are the third generation cephalosporin. So the even the question is having the patient is in the hospital for a long period of time and taking the medicines, or the peripheries of the age, be it the extremities like the children, or we're talking about the old age, they are all at the risk factors. So Clostridium difficile is is actually a normal flora, and it is present in that of the gut as well as in the feces. But what happens when we take a load of the antibiotics and the drugs? The Clostridium difficile starts multiplying because of the other inhibition action over other normal commensal floras. So that results in the formation of the pseudomembrane and the inflammation of the colon, that is a pseudomembrane colitis. And what is the drug of the choice that we give for the pseudomembrane colitis? Yeah, right. Vancomycin is the drug of the choice that we give. Vancomycin is given in the mild to moderate cases of the pseudomembrane colitis. If it is severe pseudomembrane colitis, what will give? Will give vancomycin with metronidazole. So we'll give what? Vancomycin with the metronidazole. Coming to the next image. Okay, is that fidaxomicin? Okay, so I'll just confirm that. Thank you for telling me. Yeah, this is the floppy baby syndrome. This is the floppy baby syndrome. And seen which Clostridium? That is the Clostridium botulism. And how does the Clostridium botulism act? It causes what? It is mainly a canned food poisoning, that is, and it is by the inhibition of the heat labile toxin that causes the inhibition of the acetylcholine, resulting into what? The hypotonia and the decreased reflexes with that of the floppy baby, that is the floppy baby syndrome. Now, going to the next one. This is not Anthrax Bacillus. If we'll have the image of the Anthrax Bacillus, probably you will see the different image with that of the bamboo shape appearance. If even doesn't know, we'll also can see the central spores. Now, this is an image if you clearly see with that of the blue background and pink purple bacteria. So for that you should be knowing about the acid fast one. So that is the, yeah, bamboo stick appearance, correct. But this is not the bacillus. Now we have that acid fast one, acid fast bacteria. Generally we talk about either the mycobacteria or the nocardia. Now, mycobacteria is not the filamentous like this that we have been taken the image, that the filamentous growth of the organism with that of the acid fast nature. That means we are talking about the nocardia. Now, generally, when we talk about the nocardia, along with that, we also talk about the actinomyces. The reason being that the both shows the filamentous growth and both are the bacteria showing the filamentous growth. So we might confuse. So remember, nocardia is what an acid fast while it is not. Plus, actinomyces is an obligate and aerobe. Obligate and aerobe. We have three examples of the obligate and aerobe. One is the actinomyces. One is the actinomyces. Then we have C for the Clostridium. And what else? That is the Bacteroides fragilis. So these are what? These are the obligate anaerobes, and one of that is the actinomyces causing what? That is the mycetoma. And the granules, if you remember from the mycology, we study the differentiating points between actinomycetoma and the eumycetoma, which is fungal in origin. That is white to yellow colored granules. But then we have one exception, that is the apallitree. Actinomyces pelleti, that is Actinomycetoma pelleti, that is having the red colored granules. All right, so that was the exception we talked about. Now, nocardia, it's a filamentous growth and it is an acid fast with that of the aerobic nature. Although this direct image might not be given, some history will be given along with the question. If there's like some granules discharged from that of the foot after the traumatic inoculation and that is acid fast, then the answer would probably go towards the nocardia. And if it is not, then actinomycetoma. And if we are not talking about the fungus as well, because if there's fungal prospectus of the question, we'll talk about the eumycetoma. Now, this is again that image might not begin because this is the sun ray appearance. Sun ray appearance of what? That is the sulfur granules released by what? Actinomyces. That is the sun ray appearance. So these are the what? Sulfur granules and shown in the middle of the image, and it is the organism Actinomyces israeli, and that is the sun ray appearance. Now this is the table that I was talking about, some points. Moving to the next one. Yeah, that is the Mekongki agar. And this is what? This is the Klebsiella. Because when we talk about the lactose fermentation, one we have the non-lactose fermentation by the mnemonic, that is the ships, SH, ships, that is what? SH is for Shigella. Then we have the Yersinia, then we have the Proteus, and we have what? The Salmonella. Okay, so that is the Shigella. I thought I was not live. Okay. Shigella, then we have the Yersinia, Proteus, and the Salmonella. The first two are non-H2S producers, and the last two are the H2S gas producers. This is a Klebsiella showing the mucoid growth over the McConkey agar. Why we are talking about the Klebsiella typically about on the McConkey agar? Because we need to differentiate the growth over of the E. coli and the Klebsiella, which is alike. So how to differentiate? Because mucoid growth over the McConkey is shown by that of the Klebsiella, while E. coli shows the simple convex colonies over that. That is the lactose fermentation by the Klebsiella. So this is a Klebsiella pneumonia, and this is a McConkey agar. We were talking about the mucoid growth over that. And what else we need to remember is that Klebsiella is what one of the capsulated and urease positive. Now, what are the other examples of the urease positive? That is what the punch kiss. Alright, and that is P for the protease, U for the urea plasma. Then we have N, that is for the nocardia. Then we have what C for that of the cryptococcus, H for the helicobacter, H paralyzed, and K for the Klebsiella. Then we have the staph epididymis and the saprophyticus. So all these are the urease positive. One we what is the most common, that is causing the Klebsiella pneumonia, and one is the atrophic rhinitis. So atrophic rhinitis is caused by which Klebsiella? That is Klebsiella oziana. Alright, this is about the atrophic rhinitis. Now composition of the Meconchiaga is very important. So this is the plant. This is the P for peptone, lactose, agar, neutral red, and the taurocolate bile salt. Now, neutral red is the indicator. So that is the most important. That is a neutral red. That is the indicator because Mekongkia agar is mainly a differential media. It is also a selective media, but if one of the option that is true is about differential media, because by the color change and that to the pink color, we can actually differentiate the bacteria on the basis of the lactose and the non-lactose fermentation. And the non-lactose fermentation with mnemonic, we read about the ships, that is the Shigella, Yersinia, Proteus, and the Salmonella. Alright, one we have in the under the Klebsiella group, that is the Burkholderia. That is the Burkholderia malai and the Pseudomalai. So what to remember in the malai, that is responsible for, oh sorry, we'll discuss that later, not under Klebsiella, under that of the Pseudomonas. So we'll discuss later because the image will come later. So that was the Klebsiella. Now coming to the next image. Is also caused by the Klebsiella. And which one? This is the woody nose by the Klebsiella. So this is the woody nose. I hope that the image is visible. That is the woody nose, and that is by which Klebsiella? That is the Klebsiella rhinodermatosis. Dermatosis, and that has some type of special cells, that is the Russell body. What are Russell bodies? These are the vacuolated sperm cells with that of the central nucleus. So we are talking about the cell body, that is the form cells with that of the central nucleus, that is in the woody nose or the rhinodermatosis. Coming to the next one. Yeah, this is easy one. This is the swarming mortality. We have already discussed swarming mortality by the PVSC, that is by the Proteus, and the V for the Vibrio parahemolyticus, S for the Serratia, and C for the Clostridium tetani. Vibrio parahemolyticus was also showing the safety pin appearance. Now, moving to the next one. How did we inhibit it? By adding the agar to that of 6%, or by the on the growth over the McConkey media, clade media, or addition of the ferrous ions, or adding the bile salts. Now, next one. Yeah, very true. This is what? This is the Dines phenomena. This is the Dines phenomena. Now, which is again shown by what? That is by the Proteus. Over the blood agar, when we add two different strains of the Proteus, and that is over the same media, then what will happen if there are two different subtypes? Then there will be a furrow between the two strains. But if they are of the same subtype, this Proteus will merge together. Swarming motility will merge together. This is the phenomena. Now, one, we have the Dines test that we do for the mycoplasma staining. That is the test, and this is a phenomena. So, phenomena for the Proteus, and the test that we do is for the mycoplasma. Now, that is a Dines phenomena of the Proteus, and you can see the furrow between the two different subtypes strains of that of the Proteus vulgaris. So when two strains of the Proteus are inoculated on two different areas on the culture plate, if the swarming of the two strains merge incompletely, it is remains separated by the line of demarcation. That means the two strains are different, and if the swarming of the two strains merge completely without any line of the demarcation, then the two strains are what? Identical. So that is the Dines method we are using for the mycoplasma to stain that, and the Dines phenomena we are using for the protein. Easy to remember, phenomenon is for the P and the method is for that of the mycoplasma. Now, another Proteus, we use the wheel Felix. I've just included the slide just to make it remember that we do the wheel Felix reaction by using the Proteus OX for that of the OX19 2 and the K to react with the rickettsial and rickettsial antigens because of the sharing of the antigens. That is a heterophile agglutination test. Now, moving next. Hi, Prabhakar. I think your most of the answers are very correct. There's only one image I think you didn't couldn't identify, and you are at that stage that could identify images easily. That means you totally get a chance. Now, these are two types of ulcer. Now, one is for the TB and another one is that of the typhoid. If you remember, for the tuberculosis, we have the transverse type of ulcer. All right, and just to differentiate in the typhoid, we have what type of ulcer? That is the longitudinal ulcers. So we have the transverse ulcers in case of the tuberculosis, and we have the longitudinal ulcers in the typhoid. Direct image will not be given obviously for this one, but to make you remember the type of the ulcers we see in these two. Now, this is if you can identify This is actually we are talking again about the cell molena. We are talking about the cell molena, and we get what the rose spots. We get the rose spots as one of the complication of the typhoid around third to fourth week, and we get what other complication, that is the pea soup like stools in the fourth week. Or the test that we do, that is by the mnemonic. If you know, that is a BASU. That in the first week we do the blood culture. Second week we do the agglutination test. That is the Vidal test. And S is for the stool culture. And the fourth week is for the urine culture. Now the question comes that at the end of the first week and the starting of the third week, then also we'll go for the agglutination test. The reason being that Vidal starts coming positive at the end of the first week, and it is up to clearly visible reaction, that is up to the third week starting. Now next image. This is the one of the enrichment broth. So enrichment media means broth because they are what liquid in nature, and this is the selenite F broth, and it has what? It has the selenium which inhibits the normal commensal coliforms, and it is favorable for the growth of that of the salmonella and the shigella. One is the selenite F broth that we use as an enrichment media. Next, we also use the tetrathionate F broth for the salmonella and the shigella, that is the enrichment media. Also remember one more thing is that when we talk about the Shigella, now Shigella is one of the catalase positive. And what else to remember, that although the Shigella, they are what a catalase positive, but one exception that we need to remember is the Shigella dysentery, Shigella dysentery type 1. Then we have the next exception, that although Shigella, if you remember, that is the non-lactose fermenters for the mnemonic ships, SH was for the ship. But again, we have one exception, which is late lactose fermenter, and that is the Shigella sone. All right, that is the Shigella sone, that is the late lactose fermenter. So it is selenite F bro, that was having the selenite, which was the inhibitory for the coliforms and the fecal commensals, and it mostly used for the isolation of the cell molina and the shigella for that of the fecal specimen. Okay, now what is the transport media that we use for the cell molina and the shigella? So what is that? We use what? We use the Carey Blair media. Carry Blair transport media and the buffered glycerol saline media. All right. So carry Blair media, remember to carry the stools to transport the cell molna shigella and the stool normal commensal flow, that we use the Vibro. So we use the carry Blair media for the cell molna shigella as well as for the Vibro, and the buffered glycerosaline media for the cell molna and the shigella, because the main purpose of transport media is not to promote the growth, it is just to remain the pathogen that is viable. So we doesn't want the decrease or increase in the count or the concentration, we just want the pathogens to be viable so that we can study over. Now, next one. This is not Vibrio. This is we are talking, if you can see, one is the pigment, different pigments, and they are totally diffusible into that of the media, diffusible pigments. And three types of pigment, one is blue, red, and the yellow. Where do we see that? We see that in the Pseudomonas. So Pseudomonas, that is gram negative, it is what the catalyst positive as well as the oxidase positive. Alright, and the oxidase positivity test is very important for the Pseudomonas because question also came. Now this is the pigment, that is the, this is the blue green pigment, and this is the red pigment and the yellow pigment. Now blue green pigment, that is what is the name of the pigment, that is the pyocyanin. Then we have the pyorubin and the pyoviridin. How do we remember? Just remember that after eating cyanide turning blue. Okay, so that is the cyanide for the blue color, and the red for that of the rubin, and the yellow that is the viridin. Then we also have the pyomelanin. And what else we need to remember is that how does they act? What is the mechanism of action of the toxin? By the Pseudomonas, that is the inhibition of the elongation factor 2, that is by the inhibition of the elongation factor 2, that is inhibition of the protein synthesis. Now, what else? Bacteria inhibit the protein synthesis. There is a list of bacteria inhibiting the protein synthesis and how they act. Apart from the Pseudomonas, which else bacteria shows the similar mechanism? So that is, remember by the mnemonic, that is don't synthesize protein. Easy to remember that don't synthesize protein means inhibiting the protein function, protein formation. So that is D is for the diphtheria, S is for the Shigella, and EHEC and hemorrhagic E. coli. Then we have P for that of the Pseudomonas. So they all what they act by the inhibition of the protein. What is the selective media for the Pseudomonas? We talked about the pigments and we talked about the protein. How does it act by the inhibition of the protein? Now, what is the selective media? That is the citramide agar. Now, and what is the Burkholderia, melee, and the pseudomalai causes? Yeah, citramide agar. And what is the melee and the pseudomalai? So, Burkholderia malai is responsible for the glandose disease, and pseudomalai, that is melioidosis. It is also known as Whitmore disease. Now, one more important thing since we are talking about the Pseudomonas is the safety pin appearance. Yeah, glandular fever and the melioidosis. Now, safety pin appearance, important to remember, it is the melee and the pseudomeli. Then we have the vibrio, and which vibrio? That is the vibrio parahemolyticus and H. ducrei. What else? Campylobacter and the Yersinia. So Yersinia, Campylobacter, and the H. ducrei, Vibrio parahemolyticus, melee, and the Pseudomelie. Now this is again the Pseudomonas aeruginosa. Also remember it produces the biofilm. That is why the when the bacteria aggregates against the hostile environment, they form the slime layer, they attach together to form a biofilm and forms a thick layer. This layer will inhibit the influx of any drug, and if even it has taken, it will alters the metabolism, so there will be efflux of the drug. So that is a protective measure, and that is a biofilm. One of the agent is the Pseudomonas, and it is in the cystic fibrosis that we call it as what? Algid. Now, coming to the next one. So that is the TCBS media, thiosulfate citrate bile salt agar, and it is for the sucrose fermentation, which is shown by what? Vibrio cholera. We have two, that is the Vibrio cholera parahemolyticus. How to differentiate that? It is the sucrose lysis by the Vibrio cholera and not by the parahemolyticus. And then you can see the color of the media that is changing to that again to the yellow. So that is the TCBS. Again, selective as well as the differential media for the Vibrio, because we can differentiate the cholera and the parahemolyticus by using the TCBS media. And the Vibrio cholera, that is again catalase positive, oxidase positive, indole test positive, nitrate reduction positive, and the sucrose lysis, that is also positive. So that is sucrose lysis. So that is the catalase oxidase indole fermentation, indole and the nitrate reduction, as well as the sucrose lysis test, that is by the Vibrio. And what else we need to remember? The enrichment media that we use for the Vibrio cholera is APW, that is the alkaline peptone water, because alkaline, that is they are halophiles and it will favor the growth of that of the Vibrio. Now, what type of motility does Vibrio has? What type of motility does Vibrio has? They are also known as the fish in the stream appearance, comma shape. They are what? Fish in stream appearance, and they are what? Comma shape. And what type of motility does they have? They have what? Darting type of motility. Now, apart from the Vibrio, what else has the darting type of motility? That is the Campylobacter. That is a Campylobacter. Now, moving to the next image, there is a Vibrio column on the TCBS agar, and this is on the parahemolyticus. Remember, parahemolyticus also shows the safety pin appearance. Now, one is also, it shows the Kanagawa phenomena on the blood agar, and that is the name, that is the Vagatsuma blood agar, and it shows the hemolytic appearance on that of the Vagatsuma blood agar, and the phenomena is known as the Kanagawa phenomena. Now, moving to the next one. Yeah, this is a string test. Again, we use in the Vibrio. And what is this? Is the inoculum that is made up of either platinum or the nichrome, that is the nickel plus chromium. Now, one more thing to remember is the transport media, which are important for that of the Vibrio. What are the transport medias? That is by mnemonic. We can remember cave, Vibrio in cave. That is C for the carry layer. We already talked that carry layer we are using to carry the stools as a transport media. That is for the Salmonella, Shigella, and the Vibrio. Then we have A, that is the autoclaved seawater. And then we have V, that is the Venkataraman Ramakrishna media. So we are using the transport medias for the Vibrio, that is the carry layer. Then we have Venkatam Ramakrishna media and the autoclaved seawater. Go to the next image. All right, so this is the fish school of fish appearance, or the railroad, or the tram track appearance. So this is either the tram track appearance, railroad appearance, or the school of fish appearance. Seen in which organism? Yeah, right. That is a Haemophilus. That is the H. ducreyi. That is the H. ducreyi. We get the railroad appearance, tram track appearance, or the school of the fish appearance. And this is a gram negative Coccobacillus. And also remember, when we talk of the H influenza, now that is the responsible for the conjunctivitis, that is the pink eye disease, or the and the Brazilian purpuric fever. Coming to the next one, identify the media. Yeah, true. This is the chocolate agar. This is the chocolate agar which is formed after heating up to 70 degrees Celsius to that of the blood agar, and blood is around 5 to 10% of the sheep's blood. Alright, 5 to 10% of the sheep's blood, and heating at the 70 degrees Celsius, it will cause what? RBC lysis, and this lysed RBC will release factor number 5. And factor number 5 and 10 are essential for the H influenza growth, and you can see the white colored colony convex growth over the chocolate agar. And fact, it is what? It is a type of the enriched media. Both blood agar and the chocolate agar, they are type of the enriched media because we are adding a sheep's blood. And in the chocolate agar, we are heating to 70 degrees Celsius so that lysed RBC can release the factors growth for the growth of the H influenza. Sorry, Haemophilus influenza. This is what? This is what? This is actually satellite test. Okay. Now, this is a satellite test of the blood agar. You can see by the naked eyes, point has been mentioned already, an area without visible growth. Alright, so that means by naked eye only we can see something over the media, that is the something as if like a satellite is taking off, and after that it releases the gas that is the similar to that of appearance like the satellite is taking off, and visible by the naked eye only. That is after the inoculation of the staph aureus with that of the Haemophilus influenza, we get an enhanced zone of the hemolysis near the area of the contact, and soon, and as we far go away by the visible growth actually decreases because it is the nearest to the staph aureus where it is causing the hemolysis, releasing the factors, the H influenza growth will be maximum, and as we go away from the point of the contact with these two organisms, the area with the visible growth decreases. All right, so that is the satellite test that we do for the H influenza. Now, moving next, now question will give the patient has implanted an AC in the house or something related to the ventilation, some issues are having. So, in that case, we go for the Legionella. That is what the transmission is through the AC plant, or that is the aerosol transmission. And what is the culture media? Important media for the Legionella. What is the culture media? Right, that is the Legion. And what is the culture media? Yeah, that is the BCYE. This is the buffered charcoal yeast extract media. That is the buffer charcoal yeast extract media and responsible for causing the atypical pneumonia and the Legionnaire's disease. That is the Legionella. Moving to the next one. This is one of the spirochetes, that is the syphilis. And which stage of the syphilis? That is the secondary stage of the syphilis. Secondary syphilis. And what do we get in the secondary syphilis? The rashes over the palm and the sole and the condyloma lata. Condyloma acuminata is over the HPV, that is the HPV 6 and 11, and we get cervical and the vaginal cancers by the HPV 16 and 18, and the condyloma lata, that awards that are present secondary syphilis. In the primary, we are having the painless ulcers. Then this is again form of the syphilis, and this is the tertiary syphilis. That is about the tabulus, even the patient present with the tabulus dorsalis or the aortitis, and the important one, that is the gummas. What are these? These are the dead swollen fibrous tissues in the tertiary syphilis. All right, and what test we do? That is, this is the motility. We have just taken the motility, that is the corkscrew motility, and the silver ink fragmentation, that is the Fontana stain. To see the corkscrew motility of the Trypanosoma pallidum. Now, this is the test, one of the tests that we do for the Trypanosoma. What is the name? This is the VTRL plate, and this is a type of what? Slide flocculation test. The type of what? Slide flocculation test, that is the VTRL for the pyrochates. Sorry, that is for the Trypanoma. Now, moving to the last image of the day today. This is the red pigment by Serratia. And what is the name? That is the prodigiosin. And what is the problem? It causes the red colored sputum. That is pseudohemoptysis. That is a pseudohemoptysis prodigiosin, that is the red color pigment, and by the Serratia, that is the prodigiosin. Okay, so that was a quick session, short session, 1 hour, but we have completed many images, and rest we'll cover in the next one. Okay, so thank you so much, and I'll see you soon. All right, and please do use my code that is Muskan10 to get further 10% of the discount, and do like and share. And please let me know what else you want from the topic ones. And the image will be session we'll have next 2 3 sessions more, because these are the few images only, starting with the bacteria, some important bacteria, and some points also we discussed around with that. So I'll see you soon. Do like and subscribe and follow us on the Unacademy channel as well as on the app. So take care and good night. Thank you.